Hey, my coding family, how's everybody doing? Sorry about that. I was live on TikTok and lost track of time and forgot I had moved today's live to 3 o'clock. How's everybody doing? Am I streaming okay? Can you guys hear me without an echo and see our starting screen? Let's see. You guys let me know in chat. Yes, okay, good. Not echoing today. Hey, Go-Kart. Hey, Lashley, good to see you. Thank you for the message, Go-Kart. Hey, JP, good to see you. Happy Friday. Currently at work, just stopping by for a few minutes. Hey, Lashley, I'm sorry you're at work, but you can watch the replay later, too. Hey, JP. Hey, Rihanna. How's everybody doing? Hey, Mabel. Hey, Kanisha, good to see you. KM, good to see you. Yay, now you can. Okay, guys. Miss Fagan, she did pass. I was just talking about you on TikTok for the last 2 hours. I done read out your email to everybody. You should have a reply from me, too, that says, I'm so happy and proud of you. Everybody congratulate Fagan. She passed her CPC. Yay. And she helped me out with some information about what was on it. So that's super cool. Mm-hmm. Yay! Everybody, oh yeah, look, I can do cheers now. And clapping, yay! I like the cheers better. Super cool. Congratulations, that's awesome. I know she was in here in all my lives for the longest. So that's awesome. Do you plan on getting another certification? Yes, we do have congratulations, little trumpets too here on YouTube. Yay. That is so awesome. We have 21 of you guys on, and I got 9 likes. Thank you so much, guys. Appreciate the love on the content. It really does help. Anything that y'all do on any of the content. Here's your first practice question of the day. Well, y'all are working on that one. I'll check chat. Let me know. Yeah, wouldn't that be fun? I do highly recommend, if you're not in the medicine area already and you're just getting started and you got 1 certificate, go on and get 2, because it makes a big difference when you're applying for jobs. CRC, CPMA. I've already got notes out for CPMA ready that are excellent. And then CRC notes are the ones that I plan on doing for this year. Hey, Travi.
I almost accidentally threw this away when I was at the Starbucks wrappers. By accident.
Why were you going to throw it away?
No, I accidentally almost threw it away. I didn't mean to.
Pills right there. Look, up on top. Take them all.
Oh.
I know. Well, you've been a little moody lately, and you know the Accutane, he told you that it would make you a little bit moody.
Oh, yeah.
So I'll give you a couple more extra happy pills. And then your anxiety, and then your acne. That's the bigger of the antibiotic for that. Also, will you go unplug our clown in the front yard? Because he's been making me anxious all day. And Travis, hey, Travis, I still need you to take out the trash, switch the laundry, fold the towels, okay? And brush your teeth. Guys, if we are at codes 323, 20, 30, 52, and 51, what header are all these codes under? Can anybody tell me in chat what header these codes are under? If you're looking in the CPT book, good, that's your black header. What is your blue header? What blue header are you under for these codes? Your blue headers are the procedure. What's your blue header? Yes, our one header, which is our body part header, is ureter and pelvis, but our blue header is transurethral surgery. I think, you know, making sure that I ask these questions will help others. Make sure all these codes are all under the same header and we don't have to worry about it. But if two of your answers are under a different header and two of them are under another header, looking at that before you look at the CPT code descriptors will make a big difference when you're going from question to question. All of these are all under the same header, so that's nothing we have to worry about right now. But our 20 what was the 51 and 52? What is the difference between the 52320 and 30 versus the 52352 and 51? What are those differences? You can divide these two answers into two different types of procedures. Would we be this type or would we be this type? Anybody know the difference? Yep, surgical, but what kind of surgeries? Are 20 and 30 is what type of surgery? Versus what type of surgery is 52 and 51? Anybody know what I'm talking about? The 20 and 30 are the Cystourethroscopes. So is 52 and 51, but they include in addition to our Cystourethroscope, they also include a Ureteral and our PYE thing, scope. So 51 and 52 have 3 things that we're doing, where the 20 and the 31 are just one thing, which is right here. That's in every single one of the answers. So this key term is unhelpful, right? We need to know, did we do this and that in addition, right? We don't see anything about the other 2 scopes being done, right? So we know we can get rid of A and B. If it's a difference, simply, and you get it down to where you know you only did that one scope, you didn't do the other 2 scopes with it, you know you're going to be a C or a D, but you don't know if you need to add the 32 or not. What is more likely the answer for AAPC? Would we do or give an answer that's 2 CPT codes or 1? You know, 90% of the time or more, it's usually always one answer. Even if you're doing this exam and you don't know what you're doing, a lot of times if you can at least get it down to a 50-50 shot and then just pick the smallest of the answer. This is also the smallest numerically number of the 2 codes. If you're just looking at them numerically, 20 is smaller than 30, right? Again, another reason why D would be it, but technically D is it. Because we did not do any manipulation. We did not move any stones or anything around. Look, they got it down 3 times, that cystoscope thing. But yes, D is your answer. for sure. Or C. Why is it C? What have we got C down for? I wasn't looking at anything. I was agreeing with you guys. Did we manipulate? Where did we go? Oh, we did manipulate. Sorry. We did manipulate. Lord have mercy. Where's my eraser? Totally paying attention to what Travis is doing down there. We did manipulate. You guys are right. We did manipulate the stone. So if you did manipulate the stone, that's why we added the 32 and the 51, because it's two different procedures. Yeah. I saw the stones as not moved and thought we didn't manipulate, but we did. We manipulated the stone, but the stone would not move. Gotta be careful. It is C. God, we had the rationale for that one. I'd have totally picked the cheaper one and moved on. All right, let's go look at these two. We've got two of them that are 72, and then two of them that are 74. Let's see if there's any header differences between those. 572, 572. 572, 95 and 96. And then 574, 26 and 15. What headers are we under? 275. This is a repair, right? And our 96 is also a repair, are our headers that we are looking at. And then our 74, 15 is under manipulation, moving again. And then 26 is under a scope. Did we do a scope? If we did, we know what our answer is. But no, dorsal position and retractors. Does not sound like a scope. We remove something from both sides. So it's not a scope. We didn't move something around. So our difference is between 95 and 96. Open abdominal approach or the other approach. Super easy. This one is open surgical. It would have like sutures. We went in with a scalpel. We would have Vicryl at the end, some sort of 0.5 or something sutures. But we don't have any of that. So now are we D? Yep, we are D with this one. Do you think there will be psychiatry questions on the exam? Yes, there should be a question or two about either overdosing on your medication because it was a suicide attempt, or there's a question about somebody's sister dying and being upset about that and needing counseling. Not group, but individual counseling. Yes, there is questions about those. You do your retake on 11/14. Miss Katie is taking hers on the 14th. We had, taken off my finger thing because it's driving me nuts. We had Fagan, who took her exam this week, tell us about some of her anatomy terms. Where's she at? That was on her exam. What is the medical term for removing the ovaries? The Mohs surgery had 6 blocks, so you know you're going to need that 15 code. Lab and Path was about calcium total with an electrolyte panel. They had an autopsy for a gunshot wound, full exam. P3 and anesthesia was used bunches of time. Meningitis, doing an x-ray without contrast for 3 body parts. How would you code it? Tympan, lobectomy, C-section only delivery, burn guidelines. Where is the spleen? In my notes, I have the quadrants of the abdominal area written out, which each organ noted which quadrant, like are you upper left, that kind of stuff. That's what they're asking for. Which is in the shoulder blade, a clavicle or scapula, I-10, I-12, I-20, Z codes. Muscles, bones, and tendons. Place of service, 20, urgent care, HIPAA, and Medicare. And inflammation of the eye. Conjunctivitis, right? That will all definitely help during the exam. More of the spines. We've been working on these a whole bunch the last few months in this nervous area. So if we're at 64483 versus 93, what are our header differences, if any? 64483 is under what header? And then 64493 is under what header? They're both under 2 different headers. Anybody know the 2 differences? You're welcome, Katie. Hope you got all that down. Good job. We do have somatic spinal nerves. versus our paravertebral nerves and branches. Very good, very good. There's also parent differences. For your 64483, you need to look at your mama code, 64400, versus your 93 code. You need to be looking at it. It is its own parent code, so that's good. But for 83, I think 83, maybe 83, isn't that the parent code for 83? I think. So 64400 is an anesthetic or steroid, where 64493 is a diagnostic or therapeutic agent. (64400) is trig versus 64493 is para. So we are paravertebral. Those body parts will definitely help you. 64400 is trigeminal, where 64493 is paravertebral. Paravertebral. Mark those differences between those codes. Remember to look at your mama codes, and then just word match with what's in here. That'll get you down to both A and D, right? What's more likely the answer? Would it be 3 CPT codes or 1? More likely A. How many joints did we do? L5 to S1 is how far? We would only add the 94 if we had a second level. If we did D, D equals 3 levels. Answer A equals 1 level. And the spine is like a ladder, right? So if you had L1 to L2, that's going to be 1 level. L3 to L4 is another ladder level. L5 to S1 is a level. We only did L5 to S1, so it's only 1 level. If we had done from L1 to S1, that would have been 3 levels, and that would have been where D is the answer. But level lumbar 5 to sacral 1 is just 1 level. If D was the correct answer, it would say L1 to S1. Yep. What about this one? No worries, Lashley. How are you doing on the questions? Yep, 1 level. Can you do them without the book? It's fun to try. KM, did that help explain why it was not D? Lashes says Katie has this exam coming up. Awesome. Okay, good. All right, let's look up our differences between our 63017. 630. Everybody doing okay with their practice exam questions? They don't have any codes that they're stressing over, or any other questions that don't know why the answer is what it is? You guys can ask. All right. Our 1730 and then our 42, 47. So our 17 is just a lammy. Our 30 is a hemi with a foss and a form. Our 42 is a hemi with a foss and a foramen also, and an excision. And then 47 is a lammy, a foss, a fore with a decompression of nerves. It's actually dealing with the nerves. Those are supposed to be F's. So what did we do? We did a hemi with the foramen. One of them is lammy only, so you know we can get rid of B. We did not do an excision, and we did not deal with the spinal column. Just to make sure you guys know, if 17, you have to look at code 63015 to find its parent code, to know what it includes, right? For our 42, we have to look at the code that ends in 40. So 63040 is what we have to look up. I don't know why I did a point. 040. The 47, we have to look at its parent code, which is 63045. And 30, we have to look at its parent code, which is 63020, to figure out the answers to these. You can't look at anything when you look at something in your book and you realize you're a child code that only tells you like one interspace lumbar. That's just not going to help you one bit. You have to look at it its parent code, which tells you what's included inside of it. So without these codes right here, I could not have told you what was inside these codes to know which one was the correct answer. Lashley, so how's everybody doing on TikTok? Everybody got it? Six, 7, 9. Oh, 1. Oh, 3. 6 and 8. Probably need to change these to newer updated codes. Not sure that one's gonna work. Maybe. Alright, 6, 7, 9. 6, 7, 9. Oh, 1. Yeah, we're still okay. These Bleps surgeries are definitely on the exam. Fagan said that she had these on hers. This type of procedure, remember your 03, you got to look at its mother code, which is your 01, your 06, and your 08 are all underneath the parent code of 01. They include everything that is included in the 901 code. Till the semicolon. And then you start switching out the muscles or the techniques in the procedure. Did we do a particular muscle with a suture? Did we resect something? If we did, which internal or external approach? What do you guys think? We doing D again? Yeah. All you got to do is match the name of your procedure for this one. Easy peasy. What about the diagnosing? We've got 3 answers in the C50, and without a book I know that this is primary cancer. I know anything after C6 is metastatic cancer. So if our cancer that we're seeing today is metastatic, then I know D is going to be my answer without even opening up the book. Knowing that little trick is super handy dandy. I don't see anything metastatic, so I'd get rid of D. Out of A, B, and C, it's probably not the one with the 9 in it. A lot of times those are non-specific, so it's got to be a difference between your C54 and your C58. Looking up the differences between those, and you don't have to go down to point 811, but just knowing the difference between C54 and C58 will help you out to pick out the answer for this one. C54, upper outer quadrant, and 8 is overlapping sites. Upper outer quadrant of the right breast versus overlapping sites of the right breast. Do you know the difference? We do have the upper outer quadrant, yes, but we also have the lower inner quadrant of the breast too. What would we do with this situation? The 611 is axillary tail of the right breast. Ooh, they really want you to know the quadrants of the breast for this question. Where would you put the lower inner quadrant of the same breast with an upper outer quadrant? A has malignant neoplasm of the axillary tail of the right breast. That's axillary with our upper outer quadrant thing. Are you going to code the upper outer and then say this is the axillary tail, or are you just going to say they're overlapping areas of the breast? Lower outer quadrant, upper outer quadrant versus a lower inner quadrant. Let's see. Upper outer would be, upper outer, and then lower inner. So you could see how outer and inner overlap, I guess, right? I think it's a trick question, B. I think they just want one diagnosis, not two, because that doesn't say axillary tail, and axillary is armpit. So I don't think it's axillary. Yeah, I'm trying to think about that too. And if your upper outer edges, and then a lower inner, I don't know. Lower and outer. If you only looked at those words, outer and lower, those seem like they overlap a little bit, right? Outer, outside, and lower. If you're on the outer edges and lower, those would overlap. Outer edges and then lower. If we take out the upper and the inner, you just look at outer and lower, those would overlap. Here we go. Since the sites are contiguous, whatever that means, malignant neoplasms overlapping sites of the right breast. Very interesting. Cool question. Be sure and get this one in your book. I would write that upper, outer, quad with inner, lower quad equals overlapping I just added it to mine. That way we've got it the next time we see an example like this. It's just the answer that they want. So we'll mark it and put that example in our book. Very cool. Oh, we got toenails. Yeah, the wording is crazy. You did Mohs, and it still seems confusing. I bet for somebody in the radiology area, they do not overlap, right? Your upper and your lower, that doesn't overlap. But if you're treating the breast like it's a racetrack and you're going around in circles, yeah, they could overlap if you're doing it that way, right? Oh, they sharing a common border. Ah, thank you, Blondie. Yeah, that's what I was thinking, is if you treat the breast like it's a racetrack, that upper and outer are a common border. You're going around the racetrack on the same lane. Yep. Very cool question. For those that are fixing to take their exam, their P3 was on the exam recently for a couple of examples. So that would mean you're putting somebody to sleep under anesthesia that has multiple conditions like hypertension and diabetes. They would have 2 chronics if they're a P3. Everybody got B for this one? Good job, guys. Perfect. Here's some anesthesia codes, questions. Awesome. Perfect timing. Hey, Jiggly Jello. I love listening to her audiobooks in the afternoons. Well, in the middle of the night, probably around 1 or 2 in the morning. Listening to her. She does a lot of TikToks at night playing audiobooks. If you guys haven't followed her, follow her. She's super cool if you like audiobooks like me. Hey Mary, no worries. I was running early today. I started the live a little early today. We were on TikTok earlier doing some book sequencing for the new 2025 book, so I started a little early today. My brain is not working today. It's still full of sugar and candy. We went and did trunk or treat this year at James's school. I went live on TikTok, but not very many people showed up. And plus, I didn't want to show off too many people's kids, you know, but some of the costumes were too cute. Travis was the devil, and James was Auntie Zelda. I'm saying her name wrong. The guy from, or the lady from the Lorax, the aunt. He had a whole team of high school kids. Everybody picked a character. He was excited to get to wear slippers to school all day. So he wore purple slippers and a purple scarf, Afghan thing. And his grandma made him 2 orange horns to go on either side of his little Halloween hat. So he was an Auntie Mix. I don't remember what her name is, but I know it's got Zelda in it. Auntie something Zelda. Travis was the devil. He loves being the devil. But I can definitely feel the sugar in my brain. All right. First difference is, are we a 1382 or a 400? They're both open procedures. Did we do a joint, a knee? Or did we do tibia, fibula, and then MAC? Indeed, B. Good job, everybody. Perfect. What about this one? What's our 01996 code? That's ×2 at the end. 0196. Daily hospital management of an epidural. Did they have it for 3 days? We did have management for 2 days, so we would need the 96 code. So that's cool. We can get rid of D. Did we do a total knee, or did we work on the knee joint? Everybody got C? Good job. Perfect. Oh, I got to do TikTok's little thing here. Here's your next one. Make me do the puzzle piece to verify I'm still here. I'm still here. All right. There we go. I don't see any lung venting. We just did the biopsy. So the difference between the 40 and the 41. And then you just need to know, did the anesthesiologist do the anesthesia themselves, or did they direct to other cases? If you haven't moved all of the anesthesia modifiers from your HIPICS code to your CPT book, I find that super helpful. Everything from AA to QX is super helpful. Just move all those. 1 or 2 word definitions with each one to QZ, sorry, to your book. Super helpful. That way you don't have to have 2 books open for these anesthesia questions. These just get harder and harder. When do you get on to do these examples? 3 days a week, Monday, Wednesday, Friday are my days, unless something comes up with the kids, and we have to push one off to Saturday or Sunday. But for 5 years now, Monday, Wednesdays, and Fridays, we do these examples. All the replays are available on my YouTube channel too. You can watch those. So there is a ton of practice out there for you. Why do I have it so low? Let's bring that up. Here we go. Might be too high. Oh, thanks, Blondie. You're awesome. How many do we have on? We got 25 viewers on. We got 17 likes. Thank you so much. I'm going to, normally I give out free YouTube memberships, but I'm still trying to save for Cynthia's $500 so she can retake her exam 2 more times. So we'll hold off on giving away some memberships in just a second. $25. It would still be nice to know, what is your name? Oh my gosh. Miss FC. She's killing me. She said it was. Pictures, screenshots. There we go. Everybody got B for this one also? Oh, we got another Mohs or Mohs surgery. Since Fagan said this was on her exam this week. What do you guys think the answer is for this one? And I think this is the exact question that she had on her exam. Pretty close to it anyway. I took my AAPC final exam last Friday and passed it with an 86. Yay! Now all she's got to do is her certification. Great, Jean. Yes, these are similar to the exam questions. Yep, they certainly are. This exact question, I think, is on the exam. Can you do this one? So for Mohs surgeries, the first code is usually just a body part, but we don't have to worry about that one because they're all the same. The second code, if we're going to utilize 14, we would need to know if the doctor went to the body and cut off 2 pieces from the body. This is the first time they go to the body. This would be the second time they go to the body. We would not code the 13 twice, because if we look at that code description, 173, it says first stage, and our 14 code says each additional stage after the first stage. We can't have the first stage twice. It's either the first or, and that's it. So C is a coding irregularity. You would never be able to code that, so we can get rid of that one. Now, out of the other available answers, we just need to know, if we only had one stage and we only went to the body and cut something off once, then we know B is our answer. If that's not true, if we did go to the body and cut something off twice, then we know it's either A or D. We do have a first stage, of course, and then we do have a second stage. So we will need our 14 code. That means we can get rid of B. B is not our answer. If our answer was A, we would have 3 stages. We would have went to the body 3 times and cut off 3 different sets of tissue, and all of them would have had tissue blocks under or at the number 5. If D is our answer, we had 2 stages. And one of our stages had an additional block that is over the number 5, and we would need to add our 15 code because of that. So our first stage had 3 tissue blocks. That does not indicate that we need 15. But our second stage did have 6 tissue blocks. And because 6 is higher than the number 5, we do have to add our 15 code. Because each one of those codes only does 5 blocks. So the 13 does 5 blocks. The 14 does 5 blocks. The 15 only does 1 block each time it does one. So if this number had been 7, we would have had to have times 2 it. Just saying. But anyway. Travi?
Yeah.
What are you doing?
Mama's coming to pick me up in a minute.
Ugh. I gotta get you meds. She said, you're just gonna need your... Did you already eat some cereal? You already took your... Did I give you your acne medicine in that?
Yeah, I already got my meds. I already took my medicine.
There was acne medicine.
The brown and white one?
Yeah, that was for the... That wasn't the acne thing.
No, you didn't even have it. I finished my Japanese box though, because I stayed after it. I didn't eat all the rest of it.
Did you get something from Starbucks?
These are 2 big ingredient sandwiches.
One pie. Gross. And then I gotta get you another pill to take with you. You coming back Saturday when we get back from Vegas, or Sunday? Are you coming back Saturday or Sunday? Sunday? So you only need one, really.
Well, yeah,
You
I'll come
only
back
need
Sunday.
one to take tomorrow. You're leaving that Oculus, right?
Not put Drake's on ring.
Huh?
I said not with the dogs there.
What? I can't hear you.
So I'm not taking it over there with the dogs.
Be sure and throw that Starbucks cup away. You don't want to save it, and don't let her know that you got coffee or get in trouble. No,
She don't care about your mommy.
I do.
Oh, you wanna look good? Oh my god.
Sorry, Travis going over for a sleepover. I had to get him his medicine for tomorrow. Lord, if y'all ever had any of your kids take this Accutane stuff, it is like crazy. Hard to keep up with. This one was D. Aw, thanks, V. You're awesome. Every Wednesday, but the recordings are uploaded to YouTube. Yep. And these lives are streaming directly on YouTube now, so they're automatically already saved. You guys that are on YouTube right now can automatically start hitting the rewind button and rewatching it from the beginning too, so it's super cool. Y'all work on this question while I go give Travi a hug. He's going over for a sleepover. I'll be right back. Here's his pill for tomorrow. He's had all of them for today.
He saw that we were leaving the house, and he immediately called me. He goes, "If you're coming to get me, I'm not home."
Socks. I have socks.
Yeah, they're not on your feet.
Do you have something if I say we were going to go to Havasu tomorrow and leave the house? Do you have clothes for that? And you were wanting to go to the movies on Sunday. Do you have clothes for that?
She just made, around the food.
Okay. Like those things. You're pretending I don't do that, so I need to tell you.
You got my socks? Where's your socks? All right, guys, what do you think the answer is? Is it another B? Oh, another one? I know it's got to be a difference between the two E2s, right? So it's just a difference between your 21 and your 24? I told you the sorcery convention. Try this one. Look how many levels you got on this one, guys. T2 to T9 is how many ladders? How many levels is that one? That's a new question you guys haven't seen in a while.
It's the lecture with it's the matching out the volleyball machine.
As long as you wear it out normally after, because that's meant to be birth matching right in the water.
Childless. Oh my Lord. James is in Vegas with his older brother doing a sorcery convention, and then Travis having a dog date. Gonna hang out with some dogs. You don't have your book. Oh no. All right, V, let's see. All right. If you're doing fluoroscope guidance for an injection for a combination of both steroid and analgesic, are we going to be in the 90 area or in the 20 area? Or 79 even? So 64490 is down twice. You know we don't add no radiology in this area, right? So you could get rid of A and B if you know a little bit about anything that I've taught you guys, right? We know both those two are going out the door because we don't add none of this mess. And look, we got another answer with radiology in it too. Ooh, that makes it a whole lot easier. Without even looking in the book, if you know that one little trick that anything back here in the nerves, it already includes all your radiology, you know your answer is D. Without even looking at a code. I was sitting here going to go to the codes, but then I realized, oh yeah, we can get rid of radiology. You haven't watched these? Well, these are the spinal nervous ones. I've been doing a lot of these lately. This is in the nervous section. So anything in your 644 area already includes your fluoroscope. Now, if by chance you do an ultrasound, then you're going to have a T code. It'll have a bunch of numbers like 0004, 0, and then a T. But it'll be back here, and the last digit will definitely be a T, and this will say ultrasound. Highly rare. I don't think you'd see it on a CPC, but you would see it on like a COC. But this question is super easy if you know that you cannot code radiology with these. There's only one freaking answer. Two answers, both have 90 in them. The only difference is really radiology. How many levels are we doing? there's a chart in your CPT book that gives you the name of the procedure. It says whether you're cervical or thoracic or lumbar sacral, and then it's like, are you doing 1 level? Here's the answer. If it's 2 levels, here's the answer. 3 levels or more, here's the answer. They didn't say they were doing it bilaterally. It just says they're doing it only on the left side, so it is unilateral. So 3 or more levels injected unilaterally. And we're thoracic, so it says that your answer is 644, 90, 91, and 92, all just once. Learning how to use these little charts that are next to your CPT code descriptors is really handy. I refused to learn them during my exam because I thought I should only be going by the CPT code descriptor. Because that's what medical coders do. No, use the charts. The charts make it a whole lot easier. If a CPT code descriptor has that chart, use it. Sorry, Brute Brat, if I missed anything. It's got a lot of crazy do nots over there, doesn't it? It just drives you nuts with all of its guidelines and stuff. E&M. You know we're in critical care. We just need to know, do we need the 92 or not? How many minutes were we in critical care? Would we times 2 it, or just add the 92 once, or don't need it at all? Cara, thanks for joining. We're going to add it twice. If we're going to code for any additional CPT codes, don't forget to take the time off of the total time for doing critical care for that CPT code, because you can't bill for that CPT code and charge the time that you used doing that particular code as also additionally critical care time. You can't count it twice. That's fraud. So you got to take 5 minutes off for any additional CPT codes. Sometimes the exam questions automatically take the time off, and sometimes they don't. So you have to take the time off. Cara's running to go grab her book. Awesome. Isn't that crazy? You didn't know that, Kelly? Yeah. So if you take 5 minutes off of the 104, you get 99-ish minutes. It may not change it at all, but... Everybody got an A? That's it. That's all the questions here that I had prepped for today. Let me go find you something else. I wanted to see if I had in my anatomy exam, if I had what she was talking about on the exam in her, sorry, I'm talking about Fagan. She had sent me an email listing out some of this stuff. So let's see. Do I have a question about the shoulder? Yes, I wanted to see about that one. Do I? That's about cervical plexus. That's not what I was looking for. No, thought I did. What about spleen? Where is the spleen? Not this one. Let me open up the other one. Anatomy. I got one called Anatomy Quiz and one of them called Anatomy Exam. Why did I do that? They look the same. And then I have one named just Anatomy. It's too funny. They're all three the same thing. Wow. Where's my Word document? Over here. And then Word, switch this to, which one do I have up? Anatomy Exam. That one. Oh. Change that font to something bigger. Here we go. What is considered a partial thickness wound? Damage does not penetrate below the dermis. Damage does not penetrate below the dermis, but may be limited. May be unlimited. Tissue may involve total loss of the epidermis or soft devitalized tissue. What is considered a partial thickness wound? That question is on your exam, Lashley? Awesome. Where is the adrenal gland located? Ooh. Awesome. Everybody get A for this one? This one was A. Let's see. Can we hit Control F? Do I have one for a D-R-E-N-A-L? Adrenal on this one? I got this one. Which system? Adrenal glands are part of which system? This one's much easier, I guess. Circulatory, endocrine, digestion. Everybody got C for that one. Do you know where CPT code, change this, CPT code 0402T is at? You guys tell me, what is your header for that CPT code? What is the header for that one? Category something. I'm just checking up with the TikToks. They've been talking about courses and stuff. Yes, it's in category 3, but what is its header? Where is the code in your book? Can you find it? Good job, KM. JP, Brittany, Sherry, Micah, good job. A lot of these codes in the category 3 section, they start over and over and over again. So if it's not in one area, keep going, and the numbers will recycle again and start over again. So you just got to keep looking. So this is a collagen cross linking. Isn't that crazy that the header says we're under pacemaker, leadless, and pocketless systems? But this question, this code, is actually dealing with a cornea in the eye. Isn't that weird? And what the heck do they mean by sunset January 2030? That's in my book. I'm in a 2025 book, but do they know they're going to publish it somewhere in 2030? What the heck does that mean? Is that in everybody's book? What the heck is sunset January 2030? We're only in 2024 last time I looked. I don't know what it says in the 14 or the 24 book or the 23 book. Does it say? It says in yours? That's so weird. Where's my camera? Oh, my camera just cut off. Mine literally says sunset January 2030. What in the Hades? I'm like, that is crazy. I have to do some research on that and see what the heck that means. Come on, focus. Focus, little camera. Focus. There we go. Sunset January 2030. What in the world are they talking about? I gotta go look at the front of the book. Sun. They're anticipating some guideline changes in that year. Wow. That's what that means. They anticipate that that code's going to change in 2030. Very interesting. But for now, that code was on Fagan's certification exam this week. I don't have any practice exam questions with that one in it. Let's see if I can find any. 0402T. Nope. None on Quizlet anyway, with that code in it. Okay. Too cool. Just thought it was interesting. Alright, which one am I on? I'm on this one, and we can turn off that camera and get rid of that. We did the header on that one. I just gotta do some font changes so that you guys can see any of these. This one has A, B, C, D, or E. What is this type of hernia? Is it one that is often contained in the colon or bladder? Is it low risk of incarceration? Is it a common small bowel obstruction? Can mislead clinicians as a strangled bowel, or should be manually reduced in the emergency department. Will no longer be valid. Awesome. That's good to know too. That code will no longer be valid as of that time of year. Well, in the 2024 version, it says this year, but in the 2025 version, it says 2030. So very interesting. Added to Katie's list. Perfect. Called sunsetting. After 5 years, they get reviewed again. That's such good information. Thank you, thank you. Now we know what sunsetting means. That's awesome. Ashley, you emailed me some questions. Awesome, perfect. So they must have renewed those codes again for another 25. What is the coin? What are the groups to join on Jen's website? The Discord group is really cool. If you go under the social media tab, everything is listed there. The Facebook one, the YouTube channel one, the Discord is there too. I think Pinterest is even there. We got C's and D's for answers. This one is a D. Who did that? Who got that one right? Sherry did. Good job. Very close. What was the difference? Most common or misleading? Which of these surgical connections of two tubular structures? They use this word a bunch on the certification exam. Trying to check my emails now. Indeed, A is the answer for that one for sure. That's just the definitions of all the other words. All right. What about this one? Which of the following best describes this particular vocabulary term? We've got 3 answers that have the word never in it. 1 answer that is different. Did I already get the email that you sent? Because I was looking for it. Miss Lashley, which organs are in the coronary artery? Only remember aortic. Yeah, it should have been superior vena cava, coronary sinus, pulmonary vein, and aorta. I think the differences are superior vena cava, coronary sinus, pulmonary vein, and aorta. Lashley emailed me questions. Did I already get it? At medicalcodingbyjen@gmail.com. Is that where you sent them, Lashley? Lashley's given me some good ones. Endocrine system. Yep. Hey, Patricia. Hey, Brittany. Good to see you guys. So, woman who has never given birth to a live child. So is that D? That's D. What is the medical term that means shortening, or the act of drawing back, or the state of being drawn back? Which one of these? Oh my gosh, my formatting. It's horrible on this one. She did, Lashley. Yes, those when not any of those choices. Oh no. Let's see. All right, I'm in that email. Is your email under Lashley too? Ah, there you go. Awesome. Because I was looking. Because Wade, Tina, Nate, Kelly are all the last people that, Barbara and Ann are the last ones that emailed me there. Medical coding by Jen at gmail.com. Here we go. I put it into chat. Retraction, perfect. A, yes. Good job. What about this one? Everybody got B on this one? There we go. What about this one? There we go. I got it. I see it now. Yeah, the differences between NOS and NEC, something like that. They love that question. Pregnancy questions, skin measurements and lesions. Skin measurements are easy. You know, when you have skin measurements, so let's say you're removing a 5 centimeter lesion, right? If they say the margin is 0.2, you know what your answer is for this one, right? Right? Everybody knows that anatomy question is overflow, right? C is the answer. But let's do margins, since that seems to be a question on the exam. So your total excision is going to be 5.4, right? Because every time you do your excision is the one number, right, 5 centimeters, and then whatever your margin is, it's times 2, because you have to go around to the other side. If you cut something off of somebody, they consider a margin to be the extra part that you cut off around it to make sure that you got all of it right. And and this is going to be your 0.2, and then they just do it twice just so you can get all the way around it, right? That's a 0.22. Y'all have to forgive my handwriting, but they like divide an excision into two, and if you're going to do the margins, that's the 0.2, and that's another 0.2. No matter what you remove, you could remove something that was square, it's still going to be divided into two parts of margins. So if they only tell you margin is 0.2, then you know you got to times 2 that. So 0.2 plus a 0.2 means it's going to be a 0.4. So if they tell you the excision is 6 centimeters, and then they say total margin is 0.6, then you don't need to times 2 it, right? Because your total margin is 0.6. That means your margin size was actually 0.3. They just times it by 2. Technically. So you just got to watch for the wording to make sure that was it total margin or was it just a margin? A lot of things it wouldn't matter in integumentary, but if you were like, let's see, if we were in let's see, that's grafts, that won't help. Let's see, if we were doing an excision of a foot that was malignant excision of the foot of a 2 centimeter with a 0.1 margin, what is the answer for that one? Without A, B, C, or D, you're going to go to the part of your CPT book that says excisions and malignant. Not the benign ones, but the malignancy. You're going to look for the excisions that are doing feet, not legs, but feet. And then you're going to look for the code that would match this excision. How big is our excision? Yep. Our excision is a 2.2. Perfect. Which means what CPT code is our answer? With a 2.2, it makes a difference because a 2.1 is coded differently than another code. We would be in the 116. Indeed, 2-3. And if I had said it was benign, you guys know that those are going to start out with the 114s, right? You know to at least run to those codes. You know benign, and you know your malignant codes off the top of your head. 114s are benign, and then the 116s are malignant. So then we just need to go find our foot, and we got to go find our 2.2, which is a 114 what? What would be if it was the same thing but benign? We would change this simply, probably just to 4, huh? Looks like it's the same code, right? Yeah, kind of interesting. They keep the numbers the same, but it just changed the third digit based off whether it's benign or I don't know what I'm trying to spell there. Whether it's benign or malignant. Yep, yep, yep. It was confusing on the exam. Aw, yeah. They do make it so wordy. But all it is doing this number twice. Adding it to this one, and you get a total. Unless they say they've already done it for you. If they say total with margins, then you don't have to do any adding at all. Yep, 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 yep. Alright guys, I'm getting hungry. I'm going to go eat. I'm going to go make a pizza real quick and put it in the oven, and then I'll be back live on TikTok. We will do more of the 2025 out-of-code sequencing, and I have no kids, so I'll probably be on for quite a few hours. So if anybody wants to ask more questions or anything, y'all come back. As soon as I finish making the pizza, I'll be back on TikTok because I don't feel like doing nothing else around the house. I hope this was helpful. We will do next week, Monday, Wednesday, and Friday lives like normal. Tomorrow I gotta go to Vegas. We gotta get some car repairs done, and I don't know what I'm gonna do Sunday. Probably ride scooters, something like that with the boys. But I'll be back on Monday. But tonight I'll be on TikTok, and we'll do out-of-code sequencing and get this 2025 book done with that. And then I gotta decide which set of notes we want to do for this year. Which set of notes from my prior years need to be updated. I need to decide what we're going to do. I know I'll update 2025 E&M because that section always gets updated no matter what every year. But I wonder what else I should do. I don't know. Trying to think of a section that needs it. I know I'm not going to do the nervous system. I did that last year, and I know I did musculoskeletal. I did that last year. It's such a good section. I'm not going to do that one again. There's not anything new worth mentioning for 2025, so those two sections are great. I don't think I was happy with anesthesia for some reason. Don't know why. I don't think there's no new codes for 2025, but I don't like the way I bundled them together. I think I didn't make it clear what you would be looking for. Maybe that, I'm not sure. But maybe we can work on the 2025 E&M new codes and putting in the notes for the E&M section. I gotta get some twist ties. I gotta do this stupid CPT book. The 2025 one's already unraveling on me. I know I gotta finish that. But I hope this was super helpful, ladies and gents. And if I hope I just make a difference in your guys' lives and get you guys into a better job and career that you can just transition into so many other things. And you love the career like I did. I loved my medical coding career. I loved medical auditing is what I loved. And it is just a really medical field, no matter what, always fed my family and kept me in a job. Even if I wasn't happy with my position and decided to leave a company, I never had any worry about ever being able to stay employed. Medical field is just great about that. 100%. Once you get in it, you can transition into anything you want and keep you a job for sure. And one that you like. If you don't like it, then you can find something else, which is wonderful. You've got flexibility. You know, if you don't like the coding part of it, then you can go into editing, auditing part of it. If you don't like that, you can do other things. It's great. Alright guys, I hope this was helpful, and I will see you in a couple of hours. And we'll do more practice exam questions on Monday. Love you guys. Very proud of you guys.